anonymize the patient's data, and we use dummy initials, which is not directly linked to the patient's persona. Thank you. How easy is it for the clinicians to use? Yeah, as you have seen, the system is very, very easy and simple to use. Very, very simple. Requires very simple skill and training for one person to learn how to use it. Thank you.
All right, thank you. Let's give them a round of applause. That has been JC Kulei and company. The next presenters, I'll just go back to the list. I hope you have the program with you. That is Abdul Naim Hussein and company, Mammary Protects for breast cancer screening. Are they here? Okay, deduct another one mark. Victoria, why are they here? Oh, okay. Karibu. Let's give them a round of applause. I almost deducted you guys 1 mark. Yeah.
Morning, everyone. I hope you're all well. We are Medigard Group, and we are going to present a very, very interesting solution to the problems that we currently face in Kenya. Thank you. Now, I'll begin with a short story, or maybe a rather long one. An accountant based in Nairobi called up from a station at Equity Bank, has to travel 40 kilometers from Nairobi all the way to Kiambu to get her sick father and take him to hospital, where they are met by a very unsightly and pleasant scene of a congested waiting room. Now, even upon getting the prescription, they still have to go to the prescribing window, the pharmacist window, where they are turned away and told that we do not have what has been prescribed for you. Now, this is fairly a simple problem that can be solved by a simple click of a button, as he continues. Now, even as they wait to be turned away, okay, they do not know that it will be turned away, but as they wait to be turned away, they are watching a mother with a child tugging at her skirt, waiting for the pharmacist to clarify on a prescription that, well, the right diagnosis, but the wrong drug. Yes? The prescriber did diagnose that the patient or the child had a simple URTI, or a simple upper respiratory tract infection. Yes? Thank you for that. But the prescription was an antibiotic, which, as we know, the medics in the field, as we know, this antibiotic will promote antimicrobial resistance because we do not treat URTIs with antibiotics. Now, I think we can go back to the first slide. Medigroup presents an AI-powered tool to help the prescriber in terms of alerting him when he's prescribing a drug that is out of stock, when he's prescribing a drug that is contraindicated, when he's prescribing a drug that will cause an adverse reaction to this patient. Now, these alerts are color-coded such that the prescriber can see and can tell that red means that we absolutely do not give this drug. Blue or yellow means that moderately you can proceed with caution in case you do not have another option. This system also incorporates training the AI such that we use the standard treatment guidelines provided for by the Ministry of Health to guide the prescriber in terms of what is your first-line drug, what is your second-line drug. This one is out of stock. We have an option for you. If it is too complicated for the prescriber, then the AI can suggest what you can do. Now, let me interest you by telling you that 40% of hospital admissions in Kenya are due to medication errors. 30% of pharmacist's time is spent clarifying a wrong prescription, the right patient, wrong prescription, right patient, right diagnosis, wrong drug. We want to give you back that time. We want to give that time back to you for you to counsel the patient better, give better instructions to the patient. Now, matters antimicrobial resistance. Like I gave the earlier on scenario. we are bringing to you an app or a program that integrates the existing hospital management information systems with what we are bringing to the table. The get suggestion does not negate what the doctor or the prescriber is supposed to do. It's simply a tool to help. Once the prescription is rejected by the system and they're told, no, we cannot give this one. If the doctor finds that it's a bit too hectic, get suggestion, and you get a list of drugs, probable drugs of the choice for the best prognosis, for the best outcomes of this patient. Now, let's see in actual sense what happens from our tech guru here. He'll take over and explain to you what actually happens and how this system is good and why it is good for you, for your facility, and for the patient.
Hi, my name is Cole. For how the system works, it's just the regular system in the hospital. Sorry. So, step one, the doctor enters a diagnosis in the system. He has the option to get recommended guidelines from the Ministry of Health. Step two is the prescription draft. The doctor writes the prescription in the system, and after writing the prescription, we can get the AI safety check, which checks for allergies, drug-drug interactions, drug disease contraindications, and flags issues before the prescription is saved to the database. Then, step four, if no issues are flagged, the prescription is saved. So we have a demo of a test case and how this is how the system looks like and works. So the patient has hypertension, and okay, I'm not a pharmacist, so I don't know the drug names and things. I deal with the tape. So this scenario is where two drugs with the same class. So how does a regular doctor, during the heat of, you have like 150 patients outside, there's a queue, you need to get people their medications as fast as possible. But accuracy is important. Okay. Oh, you're good. So I think we have missed a part where the system is flagging an issue. So you can see the safety alert has brought an issue where the medication, lisinopril and enalapril, they are ACE inhibitors, and prescribing both is redundant. So it's flagged, and you are told this is an issue, you should fix it before the prescription is saved. Our target market is globally, by 2030, the global health IT market will be 280 billion plus. Sub-Saharan Africa itself will be 8.2 billion plus. And we have the local Kenyan market, where we have small clinics, and we also have the big hospitals, like the Aga Khans and those. Who we serve hospitals and clinics, regardless of size. Pharmacies, so we also have stock-aware prescriptions. The patients, we have a patient-facing app where we integrate the prescriptions. It's sent to your mobile phone. You can monitor your medication. When you come back to the hospital, the doctor can see how you've been taking your medications. If you're skipping the medications, the doctor will know. So if you have chronic illnesses and you're not taking your medication, your doctor will know. And we also want to partner with the government so we can get this system in public hospitals, because that's where the need is. That's where they have the long queues. That's where this system will help the most people. So currently in the market, we have Savannah Informatics and Med Safety. But Savannah Informatics, they focus on billing. They don't do prescription. And Med Safety app, it's just a medication tracker. So we bridge the gaps. From the hospital to your home, we have one system interconnected where we can monitor your health. Our business model is B2B, between us and hospitals, B2C for the mobile app, and B2G for the government. We have software as a service model where you pay per prescription. So it's at the end of the month, how many prescriptions we have passed through the system, we bill you for that. So we are seeking $225,000 in funding because currently the system is using the Gemini API, but we would like to have more control over the AI. So having our own local AI model that we can train so that this guarantees accuracy.
What next? This is what happens. By the third quarter of 2025, we have integrated the database, the standard treatment guidelines into the AI. By the fourth quarter, we pilot launch into clinics to test, to get real feedback from the doctors, from what they think. Is it helpful? Is it effective? By the first quarter of 2026, we are aiming for full deployment. By the second quarter of 2026, nationwide deployment and MOH and NGO implementation. What we bring to the table, our impact, we align ourselves with the Sustainable Development Goals. Goal number 3, goal number 17, and goal number 12. That is good health, better prognosis for our patient, infrastructure and innovation, as well as technology. Goal number, I think that's pretty much it. And we invite you to Medigard. We implore you to come to us. We make one small step for Medigard and one giant leap for healthcare everywhere. We are Medigard. Thank you very much, guys.
Any question
Let
from
me
the
just
judges?
ask a very quick question. So I just have 2 quick questions. For the color coding, is that standard across all care providers, or is it a new thing that you're innovating on? And then the second question is, I think I heard you train the model to do something, like to understand the prescription errors. What was your data? Where did you get it? And what was your accuracy rate for the model?
Okay, for the color coding, at first we did something specific for Medigard, but on rollout, we aim for a standardized color coding across all the facilities. For the AI training, for now, we are using Gemini to demonstrate what we are demonstrating, but we aim for AI training to incorporate the standard treatment guidelines, to incorporate the protocols that are used in the treatment, the errors, the contraindications as far as the medications are concerned, and the brands that we have in our facilities, custom for Kenya. Thank you.
Good job. So if I'm getting you right, this is an API-based product, like you're integrating it with other systems, right? So I'd want you to talk a little bit more about your distribution, because essentially you won't be facing or interfacing directly, with the people using the software itself. You get, if you probably want to ship it to, let's say, the pharmacy here in Kabarak, you'll need to first interface with the provider who provided the software for the pharmacy here. So I want you to talk a little bit about how you plan on distribution, given that, most systems in hospitals and clinics are legacy systems. So just touch a little bit more on your distribution.
So currently, for now, it's API-based. But on full deployment, we want to have our own system. Because you'll find that there will be challenges, because you can't just call Oracle and tell them, give us access to some database or somewhere. So we plan to have our own system to bypass those challenges.
Can I answer this? The question is, what about patient confidentiality? I think, last one. Have you piloted this model anywhere? Well, not yet. We are still in the development phases as far as the AI training is concerned and integrating an actual AI model is concerned. But as we have shown in our roadmap, we really aim to pilot it and have real feedback, real data from real patients and real hospitals as well as real prescribers. Thank you.
Thank you. Let's give them a round of applause once more time. All right. For those, I know there are those of us who joined us while we were on. I know now we are full house. It's not just School of Pharmacy. Welcome once again. I know we've been on. I've been your MC, Dr. Goti, and we are on with the performance. Allow me, I'll not do jokes right now. I did them in the morning because in a serious session. So I just want to do call the next presenters. Monyangi, Agatha, and company. Are they with us? Where Monyangi, Agatha? Seems they're not here. Then Ags Okore and company. Let's give a round of applause.
Thank you. So, has any of you ever walked into a pharmacy and realized that the thing they are carrying, they are unable to read? The prescription you have at hand, you're not going to be able to decipher anything that's written on it. Anyone? So, I can see several hands. For that reason, we are coming up with an idea for sorry, I'm waiting for the slides on Clear RX. Okay, they are bringing our slides, so as we wait for them, I think my time doesn't count. Thank you. So most of the time we treat prescriptions like they're secrets to us only. And that's why you find it's written in a way that our patient is unable to read, and the pharm tech who is going to prescribe is going to struggle so much to read it. And we are having an idea, because our WhatsApp group that we are in as a group normally has like 7 people asking for people to help them read a prescription. Like you find a prescription posted, kindly help me read number 5, kindly help me see what this dosage is. So we came up with an idea to, what if we had an app that would scan the prescription, make it digital, and have it clear for the dispenser to dispense or to retrieve the drugs. We are calling it Clear RX. And there's a study that was carried out in Gishu County that found that only 21% prescriptions are legible. That leaves us as a very bad space. If you see the prescription there on the screen, you are unable to tell what's written, but you're expected to dispense as a pharmacy professional. And you'd say that maybe we are moving to the electronic age, but most of the time, the facilities we encounter are still not there. Or if they're there, you'll be given one to go and buy outside. Maybe it's out of stock, so you have to go and get it from a different pharmacy. So our vision is to become the leading AI-driven platform in Africa that bridges the gap between handwritten medical records and digital health systems. We aim to improve healthcare delivery and patient safety in Kenya by using AI to make medical prescriptions clear, actionable, and digitally accessible. So the value that we bring is to decode the prescription, to improve its accuracy, thereby save time for whoever is going to dispense it. We also want to connect pharmacies and clinics, because if there's a clinic near you that has a drug that's out of stock, they can maybe just digitalize it and send it to you. I know it sounds like it's the same for the one that's come before us, but it's not. We are targeting outlets in Kenya, like retail pharmacies. You walk in with your prescription, it's scanned, but the scanning is done within a box, so the issue of capturing the patient name is not there. And if we're able to pitch well for private and mission hospitals, they can also adopt this, public clinics and health tech partners. So on the health tech partners, we were hoping to merge with the already existing ones, like if we could have Maisha Meds allow this, then we would integrate the OCR to their system that's already existent, so that on the menu that's, okay, it's a little bit showing here. So one of their icons would read OCR scanner. I don't know if they're in the house today, we had them tomorrow. So if they could get the OCR scanner as one of their icons, if Zendawa could adopt this, because I know they're here, you could have one of your icons reading OCR scanner for scanning the prescription for people who already have the app. So our market size is large because we project that it could reach 50 M by 2026. And digitization is growing in line with UHC. We strategize to pilot it with pharmacies in the retail sector. We'd like to partner with the PPB, of course, to give us the data on people they're allowed to prescribe. We would use pharma reps and health IT resellers. We would leverage SHA and UHC to help with rollout. So you don't need to have complex machinery or anything. Once you have your phone and the scanner is installed, you just scan your prescription, leaving out the patient details, and what you get is just the drugs and their dosages. That's all for that part. So functions is OCR scanning, AI interpretation engine, integration with DMR, business-to-business portal, application programming. In terms of risks, we comply with Data Protection Act, end-to-end encryption, patient data anonymization, I've talked about that. Then where we'll be getting our revenues. We can give the first 30 days as free premium for people who subscribe. Then later on, if they find that it's workable for them, we can charge them. For small pharmacies, 1,500 per month, clinics, 3,000, for hospitals, 5,000. Currently, the competitors we have Medioda. They're doing the same, but it's not very up to date. Sometimes they tell you the drug you're asking for is non-existent, but if we're able to develop ours and it's able to do a lot of machine learning, maybe it can bypass that. So what we need is technical support. We need someone who is tech savvy to develop it for us. We need partnerships with telehealth. We need funding to develop the app. These are my team members. And AI is not coming to replace us as pharmacy professionals. It's coming to help us do our work better. Thank you. Questions?
Yes, that was amazing. So if I can differentiate it for you, then you tell me if I'm right. Is the other tool was for like an end-to-end operation for a clinic, and then yours is more mobile, so it's meeting the client going into the pharmacy, and then the pharmacist is deciphering the prescription, right?
Exactly.
Okay. So one question, and it's just on defensibility, like OCR, OCR readers are out here. We scan documents. There's one that I use, I think, CAM scanner. So how do you defend yourself against such a, because they are your competitor as much as they're not doing prescriptions, because they have like an OCR element into their operations?
Okay, so these ones, the ones you're talking about have an OCR, but do they have like the machine learning of the doctor's handwriting? They could scan and interpret anything else, but we are thinking of machine learning for database of doctors' handwriting that, let me say this. You get a prescription, the doctor has written something you can't see, but an AI had been programmed earlier to maybe machine learn. So the scanner that you would be using, if it's developed efficiently, would enable a specific target of handwritings. Maybe if we can roll it out to universities so that as doctors sit for their, a board exam, we're able to get their handwriting or something. I know it's a long shot.
Yes, it makes a lot of sense, and it's probably something that you should also think about. So your element of moat or defensibility is in the particular model and not the OCR, because the OCR technology already exists. So the model with the doctor's prescriptions and handwritings is what makes you defensible.
Yeah.
Very, very nice. I like the whole pitch as well. And the same thing is that I think the problem is how you're going to get your data. And I think I like the idea of not just to look beyond prescriptions for learning them or training the model. It's to me, it's like, yeah, why not? Like, why can't we just like train a model that can understand African writing? And then from there, we can then make it specific for, like, let's say, prescription writing. So very good on that. The question I have is, I think right now the loop is like the pharmacist gets to scan or have some physical written presentation. Is it possible to think of like a feedback loop to the prescriber as well, so that you can even get more data for training? Like if I can give the doctor the same prescription that I couldn't understand, but I can use that as a training label. Once they give me the correct answer, can I have something like that in the system?
Yeah, I think at the beginning of this the development, it would be adequate to get the doctors to do that. But the whole idea of bringing up the system is because sometimes it's difficult to get your doctor on phone. At pharmacy school, we are trained that if you are unable to read your prescription, call the doctor to confirm with them. But rarely you find their contact on your prescription. Sometimes it's there, but it's a contact for the office, not their personal or something. So the feedback would be, of course, workable, but only for the developmental phase, so that we don't get to disturb them and they get tired of us. But I hear you. So because we are talking AI and we are talking net and you are here, I think maybe you'll see what to do, Dr. Molo.
Thank you so much for that. As a pharmacist, you'll really help me, because I've seen doctors writing as if they have trauma. Yeah, some of these doctors have experienced some character development. That's why they don't write to be seen. Okay, without much further ado, I want to welcome. We are only remaining with almost 30 minutes, and I still have more, like 5 presentations. Kindly, the presenters who are coming, just be considerate. it's not about how much time you use, it's just how brief you can be. So, Kipto, Towet, peace, Kipto Towet, kindly come and submit your piece. You see what I did there? Yes. Let's give him a round of applause. Yes. He'll be doing Afya Sync National Digital Health System.
So good morning. I go by the name Pistoet, and on behalf of my team, we are honored to be here. My team is Morris and Gloria, and today we are going to talk about the future of healthcare. Now, the future is Afya Sync. Now, before we talk about the future, let's be honest about the challenges we face as the Kenyan healthcare. First is accessing information. The information are stored in different hospitals, either on paper or on their own systems. This makes it hard for continuity of care, results of repeated procedures, and misdiagnosis. Secondly, is management of the resources. The resources here is the medications. KEMSA being the first who provisions government medications. They do not have the actual visibility of medications from dispatch to our hospital. So it results to diversions of medication. There is wastage as a result of expiry and poor forecasting for medication needs. This has compromised patient outcomes and increased the national cost. With these deep-seated challenges, Afya Sync, we came up with the Afya Sync, which is designed to act as the central nervous system of our healthcare ecosystem. It connects the healthcare facilities, patients, and government agencies. This idea is designed to be a national idea to curb all healthcare issues. The mission is to store secure lifelong patient health records and as well to provide a clear sight of medication from government resources to the end user, who is the patient. Now, let's break down how this Afya Sync is built. It's built under 6 pillars. Now, the laptop is kind of slow. The first pillar is one patient, one record. This means that the patient records is captured from birth. Now, from birth to the end of life of the patient. To access this information, it needs a proper biometric access of the patient. And it is designed to store diagnosis, prescription, just general medication history of the patient. Take a scenario, you are in a local clinic and you are referred to a specialist. The specialist can easily log into your profile and check out your full history from birth. It is easy for the doctor. On the other side of the healthcare professionals, I think it is very easy for a doctor. Imagine reading history from your fellow doctor. You will easily understand. It must be nice to go through that and just merge up with the patient's information. This will ensure continuity of care, reduce medication errors, and eliminate redundant tests. Now, with having now the clear diagnosis and being one of the best diagnoses with clear history, without medication on our shelf in the pharmacy, this will result, it will be meaningless. So we came up with the second pillar, the smart supply. From the KEMSA warehouse to our government hospitals, then it will be handled with the end-to-end tracking. Now from KEMSA to hospital to the patient. So from KEMSA to hospital, the patient. The hospital is the middle player, but then KEMSA now will be tracking which patient is receiving the medications as well as the demographics. Now the end-to-end tracking ensures that the medication is available for the patient, no diversions. Now the real-time data logging means that the data from the patient is sent directly on real-time to KEMSA or to the head office where the medications are being supplied. In the head office, they can make informed decisions on timely manner. Most of the times in our hospitals, we see that there are no medications. Now, with this timely manner, we know how medications are being spent, the demographic of patients receiving it. Then at that time, the medication, they can predict and perform procurement earlier. Now, the smart reallocation will assist on reducing wastage expiry. Take a scenario where hospital A has a high stock and hospital B has low stock. Medication can be reallocated from KEMSA and facilitate the logistics from hospital A to hospital B. Now, medication nearing expiry will now be utilized with hospital A and B, reducing the wastage. Now, we have now the medications and we have the patient records. How do we connect all this? AFIASync provisions that an API layer is designed to connect the whole healthcare ecosystem, from healthcare facilities, government agencies, insurers, laboratories, pharmacies. Before logging into the API layer, they must be verified. And now, let's take a scenario, a patient visits a pharmacy. In the pharmacy will make an API call to obtain the patient information, dispense the drug, then on submission, all information will be relayed back to the AFIASync database. And then from there, the SHA insurers can now view on real time who the patient, the medications, billing, was dispensed by who, where. Yeah. Also, the patient will be able to view. I visit this pharmacy, served by this one, the amount of drug taken, and how he was billed. On the other end, KEMSA MOH can receive. Now this will break down the lack of access, because here now we have full information, one place which can be accessed real time. Now the fourth pillar, we have data well stored on the AFIASync database. Now we have the AI. AI will be trained previously by existing models, either from research or rather pick the data and use it to train the AI. So it will inform on public health policies, such as flagging in case of disease outbreaks, increased disease outbreaks, such as cholera, assuming hospital perform that there is a diagnosis of cholera in hospital A, B, C, D. Now that spike of cholera in the system will be flagged and facilitate necessary intervention to investigate what's really happening. Secondly is the clinical decision support. Now this one is vast and will aid from now the patient has a history of allergy. That will be stored, such as an allergy. In case of prescribing a medication allergic to it, it will flag it, and then it will also recommend several alternatives. Remember, it does not make decisions, but rather it recommends. Thirdly is the financial integrity. For insurers, it will aid with this. In case there is any billing pattern which is anomaly, it will be flagged and necessitate necessary investigations. Still on financial integrity. Recently, we have seen the SHA making headlines that there is ghost clinics receiving government funds. So this Afya Sync is designed to form a triple lock verification. It will first check if the facility is verified and existing as per the guidelines of the Ministry of Health, check the clinician and the patient. Yeah, this will create a loop, transparent, auditable, safeguarding public funds. Now, how do we form a trustable, fraudulent-free ecosystem? An end-to-end encryption, encrypted through blockchain audit, and then biometric national ID gate. This one doesn't matter who you are, either patient or healthcare provider. You need to provide identity, either fingerprints, facial, to sign in. Now, the principle of least privilege is the strict role-based, whether you are a nurse, MOH, or anyone who is trying to access the information. And then it will fully align with the Kenyan Data Protection Act. Now, the vision is, we vision Afya Sync as a future of empowered clinicians and safer patients thanks to the long life storage of records, transparent waste-free supply, fraudulent-proof national insurance, data-driven public health policies, and AI-powered predictive insights. Now, Afya Sync is the Kenyan National Health Intelligence Engine built for every citizen. Thank you.
Any questions from the judges?
Do you know how complex that is? You know?
I think I'm of the same. I've seen like 10 startups out of what you just talked about. So, so if you're just to pick one vertical that you feel would have the most impact on health outcomes, what would that be? So just, yeah.
Well, thank you. Any question from the audience? Hey, big up to you guys. You know, your project is, your project is complex than more of our relationships. All right. The next presenter, I think we'll tone down the minutes because I'm told we're out of time. So Samuel Simiyu will be giving us some input, and it will be scan treatment app for medical adherence and patient education. Kindly, if you spend 5 minutes, they add you 2 points. All right? Spend 10, and you'll know.
Good afternoon. My name is Nick Gombe, and my team and I, Samuel and Jonathan, are co-founders of the app idea called ScannerX, where we aim to bridge prescription to adherence. So ScannerX is a digital health platform designed to combat the rising threat of antimicrobial resistance in Kenya by empowering patients and enabling real-time monitoring for providers. And also our app provides medication adherence and streamlines prescriptions and strengthens the entire healthcare ecosystem. So our core features include QR scanning for instant drug information, multi-language support for patient education, offline functionality to ensure accessibility, and then adherence tracking for patient and provider insights. Okay, so the problem. So non-adherence to prescription is a silent crisis in Kenya with significant implications for public health and rising rates of antimicrobial resistance due to misuse of antibiotics. Just some statistics, 71% of patients in Western Kenya struggle to adhere to their medication regimens, leading to worsening of health outcomes. And then misuse of antibiotics. In 2021, antimicrobial resistance was responsible for around 6,700 deaths in Kenya alone. And the misuse of antibiotics contributes to the alarming rise of AMR, threatening effective treatment options. Then the risk for medication errors. Without clear information, patients may misuse drugs, especially in rural Kenya, where we have the issue of language barrier. Then where also access to pharmacists is limited. Next slide, please. So we conducted a small survey using a small population of patients, basically to validate our assumptions about how willing are they to use the app. So from our data, we found that 62.5% of the patients we surveyed forget to take their medicines, and 75% of these patients credit forgetfulness to why they forget to take their medication. And then 87% of the patients we surveyed want reminders for doses, and then 75% prefer local language support as opposed to what we are used to, like English and Kiswahili instructions. Say they would love to have a functionality where they can get to access their medication instruction in a local language. Then, okay.
So what solution do we propose as CanaRex? We are trying to create a program that enables the technology of QR scanning. As you can see in our banners, QR scanning is all around us. And so we want to use this technology to harmonize prescriptions that are given at the hospitals and at the clinics. So what we want to do is when a patient receives a receipt paper, it contains the QR code, and the patient is able to scan this QR code and have the prescription that is given by the prescriber right on their phone, so that they can see it and see the drugs that are given to them. So we are proposing QR code scanning where users can easily scan the codes. We also have prescription management and an analytics dashboard where all the scanned prescriptions and the drugs on the prescription will be within our servers. And then we also want to promote patient education on these drugs. We want to deconstruct pharmacy, we want to deconstruct the drugs into a simpler way in which patients can understand. And that will also help in bringing awareness on antimicrobial resistance. Yeah. So who are the people we are targeting? We're targeting patients, healthcare providers, and healthcare facilities. And for the patients, we want them to benefit from reminders and supports that are present in our app. And for the healthcare providers, we want them to gain insight on patient adherence. They'll be able to see if a patient has taken a drug by simply through using our program. And facilities, healthcare facilities can implement CanaRex to enhance their services to ensure patients receive optimal care and follow-up. So we found a major competitor and the current Kenya healthcare information systems. And since they have a wider reach, they have a government backing, and they also have the national system integration, we saw that they have a go-ahead more than us, but we also offer something different. We offer the QR code scanning, we offer a local language support, so we can get to more people. We also are targeting the antimicrobial resistance, and we're also focusing on patient education. We want to see if we can target the patients directly. And also we want to give remote prescriptions. Yeah, next. And so we are going to give you a simple demonstration of what our app looks like. Yes.
Okay, thank you so much. So maybe 2 minutes due to time. Let me just run you through. So the first thing there you can see, we are fighting antimicrobial resistance together, and the tagline is scan, learn, and track, meaning that the first thing you are starting with, you are scanning the QR code. After that, okay, thanks so much. So I said our tagline is scan, learn, and track, meaning that the patient comes and scans the QR code. He gets the information that he needs from the drugs. That's the dosage, the drug, the indication, and everything. Then after that, the patient can be able to track. So our app has two interfaces. That's the patient interface, and the other one is the healthcare provider interface. Allow me to sorry for the interruption. So our app has two interfaces, where we have the patient interface and the healthcare provider interface. Coming to the patient, whenever the patient has scanned the QR code, the first thing it gives you is that option, that page, where we have the drugs that has been prescribed. That's amoxicillin, paracetamol, and rifampicin. So for amoxicillin, we can see the instructions. Every 8 hours, take it for 7 days, take with food, and complete the full course. Even if you feel better. For paracetamol, it has been indicated it's for pain. And for rifampicin, we have instructions once daily for 6 months and take on an empty stomach. We also have reminders that after the patient has received this, he can be able to activate the reminders. So as you can see, the drugs were taken at 8 a.m., others were taken at 9 a.m., and it's now at 12. So you press take now after you've taken the drug. Then below there you can see the patient missed the yesterday's drug. Another feature is adherence. The patient, he or herself, can be able to track their own adherence. Back to the healthcare provider interface, it has 3 features, whereby the doctor is able to see their prescription, the number of patients are there, the medication, the dosage, date, status, and the action. He can also check the biodata of the patients from his own end. That's John Doe. He's 45 years, he's male, and he's taking 2 medication. Adherence rate is 95. We also have the analytics, and we also have the issue of AMR stewardship. There, the drugs being taken. Then lastly, I'd like to conclude with this. Why our app has a focus on Kenya? 4 points, because in Kenya at the moment, antibiotic misuse is becoming widespread. 2, TB and other infections are posing a large threat. And also, this issue of scanning, it will be okay because smartphone adoption is growing rapidly. Yeah, that's it. Thanks so much.
I think you're onto something. Probably just a word of advice on how to rethink, because you're also doing like handling different touch points. Is if I'm a patient, already being sick is a hassle. So I don't want to go in, and if you can rethink this as an edu platform for taking drugs, gamify it, make it like a Duolingo of taking drugs or something. You can be, you can make something out of it. Because if I'm a patient, I think what I want is to get better. That's why we have the resistance issue. Because once I feel better, I stop taking the medication. So giving them an extra task will have, the innovation might be good, but the person you're building it to or for will have a mismatch. So if you can gamify it, make it interesting, I think you're onto something.
And I've just mostly seen very good work and taking the feedback as well. It seems like it's focusing on the prescription side, but I think it's also important to think about the dispensing aspect and make the experience easy for the patient, as we said. Like, to me, the more important thing is just I'm getting better and I know what I'm taking, and then I have the drug info that I need. So I think using QR codes, I don't have to to go online. Let me scan it with my phone, on my camera phone, and then put it on like some app that can then give me the info I need. Not need to be complex.
Thank you.
Any more? Thank you. I think that's it. Okay, so I'm being informed that time, unfortunately, is out. So what I want to do is I'm remaining with 3 presentations. I just want to see how many are in the room. Hope, Diego, Rachel, Sandra, and Angeline, Rebecca. Where are you? Okay. Now the thing is, I'm told that we are almost having the closing ceremony. The management is around. So I just want you to pitch up the idea. I'm sure as long as they can pitch the idea, let me give them an opportunity, because I was told to close it up. If they can be able to pitch it in less than 5 minutes, kindly. You don't have to read everything in the slides. The judges can be able to just see a potential project by even a statement. So if you're here, Rachel, welcome. Let's give her a round of applause. If you feel projecting will take more time, don't just be free.
Okay, good afternoon, ladies and gentlemen. Before you is Rachel, on behalf of CleanPro Pharma Solution. What I would like to say just in a few minutes is that with clinical trials, because our proposal is about e-recruitment for clinical trials. All of us, we understand that clinical trials bridges the gap between scientific discovery and real-world patient care. Okay, it will be a digital recruitment platform tailored for pharmaceutical, clinical, and medical industry in Kenya and beyond. It will connect qualified pharmacy professionals, clinical researchers, regulatory consultants, and healthcare specialists with employers such as hospitals, pharmaceutical companies, NGOs, and government agencies. Its aim is to revolutionize participant recruitment in clinical trials. Our problem statement came up from a published document or the article whereby we had, according to Mira Desai et al. In 2020, in Perspective in Clinical Research, the report showed that globally, more than 80% of clinical trials fail due to enrollment time, which results in extension of the study and or addition of this new study size just to meet the number of the participants that had already been calculated. And again, another journal in 2023, it was about Clinical Trial Arena, documented that patient recruitment is essential, but today, nearly 80% of the clinical trial fail to meet the enrollment timeline. And this one we can see even from yesterday's first presenter, who also said the clinical trial has a high failure rate just in terms of timeline. Then we had another problem statement of traditional method being costly, slow, and lack of reach, and even there is lack of diversity in participant selection. From the problem statement, we had our vision and mission. The vision is to be the leading digital recruitment solution for pharmaceutical and clinical professionals across Africa and beyond. And the mission now, whatever will make us to meet our vision, we had a mission being to stimulate the recruitment process in healthcare by offering a trusted, efficient, and technology-driven recruitment platform, just to ensure that there is compliance, professionalism, and speed. Our expected outcome, when you do anything, you have expected outcome. For us, our expected outcomes will be, number one, to increase trust and participation in e-clinical trials recruitment across a diverse population. Another outcome that we expect is to have a reduced cost and duplication in recruitment through coordinated platforms. The third one will be to strengthen regulatory compliance and participant protection in digital system. Then the last one will be to be a scalable model for national and regional adoption for e-recruitment in health and research. Our key performance indicators will be if we can have 1,000 professionals onboarded within the first 1 year and have a 75% market retention. The value proposition, having the AL, that is artificial intelligence machine engine, digital outreach campaigns, pre-screening portals, e-consent tools, and real-time analytics dashboard. The unique value proposition statement, what are we bringing in as a unique one? As Clean Pro Pharma solution, we will provide the missing link in as Kenya shifts to e-recruitment for clinical trials, while other research institutions, like the contracted recruitment organization, as they bring on board the scientific expertise, ours will lie in community trust, agility, and integration. The core value is just humanizing and localizing this digital recruitment, turning the e-clinical trial platform into a trusted, community-centered system that works in real health practice across Kenya. The market opportunity, we are going to look at global clinical trial market, digital recruitment market. Initial focus, we shall start with Kenya and East Africa. Then our expansion goal will be Sub-Saharan Africa and beyond. Our target customers will be pharmaceutical companies, contracted research organizations, academic medical centers, and non-governmental organizations and government projects. Competitive landscape. When you come in the market, of course, you have other competitors. So our competitors landscape, we have so many, but just to mention a few, we have Trial Spark that is very strong in US, but the weakness is we don't feel it in Africa. As if we can remember, our first presenter yesterday said that in Western, the clinical trials take a shorter period. That's why, when we have studies in Western Africa and here in Africa, you find that for the Western, they'll finish within a short period of time, but for us in Africa, it takes longer because we are not able, our system takes longer. Maybe your period has already elapsed and you haven't even met your study population. So you need to look for other study sites or you increase the recruitment period. Then we have another local RCOs. Example is AMREF, though we have so many examples. AMREF works mostly with community, knows the population very well, but it doesn't do the e-recruitment for clinical trials. Another one is PATH. I know some of us, we've worked with PATH, or you know PATH, Partnership Appropriate Technology for Health. They do a lot of researches, like even in vaccines. It's okay. Yeah, and PATH is normally project-specific, donor-driven. So what limits them is that when the donor pulls out, it means that project ends there. But for us, whatever we are bringing in, we want to have the continuity. So I'll just go direct to technology stack. We shall have the front-end, back-end database, hosting, and security. When you are dealing with human data, we have to know, you have to protect according to Data Protection Act of 2019. We have our action plan. I won't go through it. Financial projection, team structure. We have 6 members in that group, and every member has been given responsibility. So what is my call to action? Our call to action is Clean Pro Pharma Solution invites donors, regulators, and research partners to collaborate in building Kenya's first community-centered e-contracting framework. Together, we can ensure that digital innovation in clinical trials is not only technical sound, but also socially trusted and sustainable. Thank you.
Thank you. Do we have 5 minutes, kindly? I'm not the bad one here. It's the time. It's not me. It's you. Okay.
Good afternoon, everyone. So as I'm setting up, I would like to introduce myself. My name is Hope Yego, and I'm presenting on behalf of Elimu Afya team. So we are a healthcare education software, creating a healthcare education software tool. And let me begin. So as a training pharmacist, I can say that what has been emphasized across the years that I've been learning is quality by design. And for the most part, we have been applying it in terms of the pharmaceutical supply chain. But I have kept asking myself, in terms of patient care, how are we actually applying it? So our product and our company, we are seeking to actually bridge that gap. Yeah. So I'll be giving you very briefly our background, our product, our business description, as well as analytical logistics and who is in my team. Because as you see me here today, we are 4 people, but my colleagues wouldn't be able to make it for the moment. So as mentioned, what we are trying to seek is to be able to improve seeking to solve include inefficient integration of clinical skills and competence in healthcare students, as well as improving there's a challenge in terms of documentation and record keeping. Traditional systems of assessing students tend to rely majorly on paperwork. So you see students carrying around the hospital papers, the care forms and all that. So other than that, these challenges that we are seeking to solve, we were able to interview not only our lecturers, but also students within the healthcare. So from our instructors and our lecturers, they were able to inform us about the overwhelming backlog of student evaluations faced by them in clinical and academic settings. Because for a majority of them, they're not just serving 50 students, they're probably serving 3,000 or more in a semester. Other than that, we do not fail to acknowledge that there are already existing systems such as eMedley, IntelliSoft, and among others, Insight 7. But the challenge is that these existing systems focus on exam-centered assessments and less to do with patient care and within the clinical setting. Other than that, most of them are compounded with complex interfaces, limited customization options, high subscription costs, and data overload, which we will be seeking to address. So our product at Elimu Afya, and as we seek to be the solution, we are looking to offer customizable clinical assessment forms that meet specific training needs for healthcare students, as well as flexible grading rubrics that reflect achievement of practical competence and tracking of student performance, which, looking at how passionate my lecturers have been, especially in terms of the clinical aspects, it would be really key for them. And other than that, we have an additional advantage where we would like to create simple user-to-user interfaces with adequate cloud storage for data collection. Because at the end of the day, we're not looking for the students to be able to just be assessed and lose the document and lose whatever they were learning for the day, but to be able to go forward with it and even see how they can progress in terms of biomedical research. So in terms of our business model, the people that we are seeking to actually target are students and instructors in medical-related academic institutions. So those would be our users. And how we would like to reach them is through digital marketing and partnerships with institutions, including Kabarak, because charity really begins at home. So you would inquire, how are we going to make the money? Or how is revenue going to be generated? So we're looking to have adequate and flexible subscription options and models that include a tiered pricing strategy, which in that sense, what we're trying to say is that where our users are the students, are the healthcare instructors, but the people who will be paying us essentially are the institutions, because coming to each individual and convincing you, we do understand the hurdles of resistance in user adoption, especially when it comes to technology. So we would also be looking to have a free version for early adoption, especially during our pilot program, which I'll be talking about in a few. So other than that, how will we be ensuring customer satisfaction? So we are creating a sustainable feedback mechanism that allows us to collect user views and improve the customer experience. So in terms of Kenya, in terms of Africa, and in terms of the world, we can talk about the opportunity that we have, which is a market size of 10.4 billion Kenya shillings within the medical education market globally. And in terms of growth trends, it is projected that we will have 8 to 12% compound annual growth rate over the next 5 years, which is very crucial we are seeking to create a sustainable business. And our target segment, as mentioned earlier, is academic institutions, including this institution right here, that offer healthcare courses at all higher learning levels. So we're not just targeting degree programs, we're also targeting diploma as well as even certificate programs that are just within healthcare. So in terms of our budget and our timeline, we are in the process of developing our software, and even due to course of time, I might not be able to talk more about the MVP, but it's taking us a period of 6 months, and we will have a pilot program where we are seeking to work with 2 institutions. Specifically, as I mentioned, charity begins at home, so we will be looking to work with Kabarak University, as I'm a student here, and another university in another geographic region within Kenya. Also, in terms of clouding and infrastructure, because we are looking to expand, and that will require a period of about a year, as well as you can see, going forward, we will now be having our sales personnel and operating expenses, as well as our marketing and outreach. So for the software development, which basically is the coding framework, as well as the personnel who are working on it, we will be needing an amount of 3.06 million as well. So in summary, our total cost is 11.7 million Kenya shillings. And in terms of our financial projections, within the first year, we're looking to work with 5 institutions. Within the next 3 years, we're working to increase the number to 7. And in the next 5 years, we are looking to increase the number to 10 to 12, and also across the region of East Africa. So in summary, in the next 5 years, we will be looking at a net profit, and not even the cash inflow, but a net profit of 17.26 million Kenya shillings. So lastly, I'd like to talk about my team. And I myself, Hope Yego, I'm the Chief Executive Officer. I'm a student here at Kabarak University in School of Pharmacy. Beatrice Akatu, our Financial Officer, is a graduate of Kabarak University. Wangari Amari, our software developer, who is a graduate of Princeton University in the US. Sage Abuao, who is our cybersecurity lead, is a graduate of JKUAT. So even as we are working on this, we're not just focusing on one institution, but working with everyone across Kenya and across the world. So thank you, because I would like to leave it at Elimu Afya is not just a software. It is the future of healthcare education, and the future starts with us. Thank you.
Thank you so much. Now you understand what working under pressure means. That was amazing. I don't know if I've closed anyone out. Any presenter that hasn't presented? At this particular time, if there are no more, I'll just allow the judges to maybe give some few comments as they compile the results. Maybe you can make some few comments, what you've observed, and then we'll be able to proceed.
Yeah.
It's 30 minutes past noon, so good afternoon. It's been exciting. I think we've had 4 hours of innovation and brain stimulation. And being a thought leader on LinkedIn, I don't know how many of you are on LinkedIn, there's a huge conversation that is ongoing right now that the Valley or Silicon Valley is building for the wrong things. I think I was there some 8 months ago, and I've been here for, I think, 4 months now. And I cannot concur more, because everything that I've seen here is life or death, except a few, but most of them are building for life or death situations. Antimicrobial resistance, prescription deciphering, those are things that if you get wrong, might actually kill you. So I want to kind of motivate you that if you're thinking global, just know that you're building in the right market and you're building the right tools for the right market. Thank you.
Good afternoon, everyone. My name is William again for the guys who just come in. I work for Google. I was one of the judges in this very, very nice innovation session, and thank you all for guys who contributed. It's an amazing set of projects and ideas that we have in mind. We've learned a lot this morning around all different kinds of topics, mostly in the medical space, prescribing, dispensing, sharing information and all that. I think there's a lot of things we can do. And to the innovators, keep on the good spirit, keep on the fight. I think you'll get there. Just scope everything to the right amount based on how you can grow later, but always just scope your work and make sure it's doable, that and you can get supported when you're doing it. So thank you again, and have a good afternoon.
Thank you so much. I think after such an insightful, innovative presentations, I'm elated to also be innovative myself. I just don't know, all of us who are here to this day, what have you innovated? Anything innovative? At this particular time, I just want to give my judges time to ponder on the results. I'll probably take a few questions as we wait our Vice-Chancellor to join us. Kindly, our team, be ready with the national anthem. When the Vice-Chancellor comes in, I request all of us to be upstanding. Then we'll be able to do the national anthem. In that regard, let me hear from the mighty audience. You guys look outstanding, even if you've sat. And I know you guys have innovative ideas. I know not all of them could get there. But just tell me. Because to me, today, the only thing I innovated was a text I sent to someone in the morning. I'm an innovator. My brother, you look very innovative. Tell us your name and what is any innovation you think you've done?
My name is Nathan Kimutai. I'm a computer science student here. And for innovation, I think this is a good opportunity to learn from different people and different innovations and grow further.
What about yours now?
Mine, I've worked on an innovation on agri-tech, known as green tech, an automated greenhouse system.
Give him a round of applause. Maybe next time you'll find a way, yeah? Thank you so much. Let me also hear from this other side. Hello, how are you? You know, when you don't look at me, that's when I choose you. Yes. Hello, how are you? Please talk to me. Tell us your name, which school you're in, and tell us an innovation that you have, or probably tell us what stood out for you throughout this Central Rift Innovation Week.
Hi, my name is Amira Ibrahim. I'm an oncology MPharm student. And this has been an insightful conference throughout this whole time. And I'm looking forward to contribute to the sector of the cancer.
Let's give her a round of applause. She's our the School of Pharmacy is offering Master of Pharmacy in Oncology Pharmacy. And wow, I'm very proud of that. Let me move to the backbenchers, ndani ya S-class. Yes, where is your S-class, my brother? Please tell us your name, the school you're in, and tell us something that has stood out for you through Innovation Week, and how has that impacted you as a student rather, or as a scholar, on how you're going to move forward as an innovator.
Oh, my name is Rodney Kibet. I'm a student at School of Science, Engineering and Technology, taking computer science. And this week has been very educative. I've learned a lot. And at least I've gotten some ideas that I can explore and do for my future projects in innovation.
Thank you so much. Wow, that is very insightful. I can see you're a Bayern fan. Do you think Manchester United can innovate success? Oh, I'm just saying, guys, I'm not personal, I'm just saying. All right, thank you. That is very insightful. I hope you will be united in it. All right, hello, sir. There's nothing you're pressing on the laptop. Now, talk to me. Hello. It's very busy. When I reach there, now that's when it's, now this mic is your type. All right, hello, sir. Tell us your name, tell us, the faculty you're in, and what do you think innovation stands? Now, I do understand, because I know you're in the School of Music. How do you think we can use technology and innovation to push the aspect of technology, especially in music production and all that pertains to it?
Well, thank you very much. My name is Bichanga Brian from the School of Music and Media. Yeah, so for your question, I think the main thing we should do mostly as innovators and as future thinkers, I think the most thing that we should do is actually spend more time experimenting with all these tools and everything that is available to us as of now. And so when it comes to innovation, we look at what the problem is, we look at the gaps that actually exist, and then we try as much as possible to come up with solutions and use the available tools that we have in order to make the difference that we're looking for. So yes.
Thank you so much. I didn't hear, but I know that was a strong point. Chelsea fans, they always have strong points. Yes, thank you so much. Let me pick one more just to balance it up before I welcome our Director Innovation and Research. Who feels they have something burning? You feel kuna kakitu tu, siseme mimi ndo nimekalia nyota. My brother, you look kama uko na nyota. Kuna kitu inaniambia kwamba uko na nyota, ndugu yangu. Sema usiseme nilikalia talanta.
Yeah, good afternoon. So my name is Cleveland Otieno. It's been an educative session. As for the medical part and the innovative sectors, in terms of innovation, I see that we should get to a point where we can put the past, which is the contemporary medicine, and the future, which is the tech and the AI stuff. That's all I can think about.
Let's give him a round of applause. Okay, thank you. I don't know if there's anyone who can now tell us an innovation in Kiswahili. I've seen. Anyone who can, nani ambaye nimefungia pia? Kwa mara ya kwanza, kwa mara ya pili, now see, how do they say it? Unyamaze milele. All right, anyone? I can see bright lady over here. Please, say something as we close. Let's give her a round of applause.
Okay, so I hope you're all having a good afternoon. I think it's been an amazing week. I think I've attended all the sessions of the Central Rift Innovation Week. And as well, coming over to this side, to the conference of the School of Pharmacy, and getting to see that it's not only those in the School of SET who are innovative, but even those in the School of Pharmacy. And medicine can as well be innovative, which means it's not just for the tech stars, it's for all of us. So let's all get into this.
Thank you, thank you. Now, my last question, as I complete, I want someone to tell me innovation in Kiswahili. Ukombozi. Ukombozi. We wacha bwana. Innovation in Kiswahili. Yes.
Uvumbuzi.
Uvumbuzi. Endelea kuvumbua tu. Wacha nisikie. Innovation, technology, hiyo utajua. Innovation in Kiswahili?
Uvumbuzi.
Uvumbuzi it is. Thank you so much. That has been my time. Ladies and gentlemen, as we close this year's Central Rift Innovation Week, I stand here humbled to have watched ideas take shape, and as such minds, we have pitched not just innovations, but courage and solutions. So at this particular time, before I introduce the director, allow me to do what I do best in a minute. I had prepared something in relation to innovation, and this is my piece as Ogoti, the boy child, the only gentleman with a boyish name. You see, this Central Rift Innovation Week has tested me, have queried myself. Is it just a week or I'm weak? Probably I'm strong. And as I watched you pitch ideas, apps, solutions, websites, where the only thing I could pitch was my high-pitched kissy voice. See, last night, my bedroom turned into a mosque because walai nilikuwa na swali. How do I innovate? Where do I innovate? What if I never innovate? What if my degree becomes just another paper, another drama certificate, and my life another stage of drama? I clenched my fist in my sleep. Crew had given me a mental blow, now dental flows. I wrestled with the question, am I built to create or doomed to copy? Paste my life. But when morning light broke the silence, I realized I may not be an innovator. I am an innovation. I am an innovation. I fill the gaps you don't see. My words fill your hearts. My words patched broken hearts. My pieces are bandages. My lines are sutures. My metaphors close wounds. This medicine that I give can be the medicine to your soul, the medicine that touch without hands. You see, I am an innovator. And every day I create. Every day that I breathe, yes, I build. Every stanza I reinvent survival. Trust me, I am a work of art. And dear innovator, dear student, dear scholar, dear pharmacist, dear Kabarak family member, and so are you. We are not just chasing innovation, we are the evidence of it. Every hustle, every dream, every failure turned into lesson in innovation, in motion. Now you see, this house is not parliament, but still we have dreams in motion. Now you can see, one poet says that your eyes is like a class, and that's why it has pupils. So next time you look at me, don't ask what has he built. Ask instead, what gap has he filled? Because my life is the answer to the question I once thought that will break me. I don't count myself as an innovator. I am an innovation. Thank you. At this particular time, I am honored to have been the moderator for this amazing Innovation Week. My name is Dr. Ogoti Moses. I was a student here, now a proud alumni and also a poet in that regard. If you want to see my work, look at Ogoti the Boy Child on all the social media platforms. At this particular time, allow me to welcome with honor the Director in Innovation and Research, Dr. Philip Nyawere. Let's give him a round of applause. Thank you.
Thank you so much, Dr. Ogoti. Can we clap for Dr. Ari? We are proud of you. You are representing us so well. To our Vice-Chancellor in absentia, Professor Enrique Plangat, and to our DVC, Academic and Research, Professor John Ochola, who is here with us, and also to our librarian, Madam Patricia Chebet, and to the directors present, heads of department, deans who are here. Good afternoon. Students, our esteemed students, good afternoon. Thank you so much for being here at such a moment. Sir, this gathering is a culmination of the Central Rift Innovation Week 2025, which is now coming to an end. And we are so much privileged to have you around so that you can be able to close this event for us. To the innovators in the house, I know your heartbeat is rising. At the end of the speech of the Vice-Chancellor, we are going to announce and tell you the way forward. And sir, you can see, just look at the presentation here. It tells you how busy our campus has been this week. If you look at the sponsors and all these banners, it tells you that things have been happening around because of your support. So ladies and gentlemen, help me to welcome Professor John Ochola, DVC, Academic and Research.
Thank you very much, Dr. Philip Otieno Nyawere, my namesake. If only you could change those E's into A's, then the name would sound very nice. But it is nice as it is already. Good afternoon, ladies and gentlemen. I want to congratulate you for your staying power. Some of you came here on Monday, and you have been here until this afternoon. We don't take it for granted. I am here to represent the Vice-Chancellor, who could not join us because he is in another meeting. But receive his greetings and his apologies as well. I do recognize the input from Ogoti, the boy child. This young fellow was our student and remains our postgraduate student, isn't it? Dr. Ogoti. So please come forward if you will. He has come back to give back to his university. We really appreciate it. Just remain there. And also let me request Professor Wanyama to come and join Dr. Ogoti. These are innovators in their own way, isn't it? When you look at them, what do you see? Yes. And let us give them a hearty hand clap. A very sharp sense of fashion. So congratulations. Thank you very much. The Vice-Chancellor sent his address here, which I will proceed to present. And after this, then there will be an icing on the cake. the cake that has been in preparation for the last one, for the whole week. So this is what the Vice-Chancellor says in his closing remarks. The members of the university management present, deans of schools, directors, Dr. Joyfrida Chepchumba, program officer in charge of treatment, palliative care, and survivorship pillar, National Cancer Control Program, Ministry of Health. Dr. William Ogalo, senior research scientist at Google Africa. Dr. Winnie Mwangi, oncology pharmacist, Kenyatta University Teaching, Referral, and Research Hospital, and Vice Chair, Oncology Pharmacist Society, our sister universities, research institutions, industry, and the community. This year's Innovation Week, which coincided with the School of Pharmacy Research Conference, has truly lived up to the theme of transforming ideas into impact and advancing access to quality cancer care. We have seen inspiring prototypes, groundbreaking research presentations, and passionate conversations about how innovation and research can solve some of the most pressing challenges of our time. From climate change to food security to education to agriculture to digital transformation, as well as access to quality cancer care and health technologies. Ladies and gentlemen, I wish to extend my heartfelt appreciation to our partners and sponsors and schools within the university that participated. And our partners and sponsors include KIPI, Boresha, DT Sacco, Ansa Village, Skyline DT Sacco, International Cancer Institute, Nakuru Box, Ministry of ICT and Digital Economy, Maisha Meds, PSK, Zendawa, and OPSK. These partners have walked with us the journey of making this event a resounding success. And at this point, let us give them a hearty hand clap. Your investment and belief in the power of innovation and research have created a platform where ideas are discussed, developed, and deployed. To our innovators, researchers, and entrepreneurs, your work this week has reminded you have dared to dream and you have dared to build. I encourage you not to let this momentum end here. Years of tireless efforts. Your work behind the scenes ensured that every session ran smoothly and every participant had a meaningful experience. As we close, I challenge all of us to take the spirit of Innovation Week beyond these walls. Let us become ambassadors in our workplaces. We have the silver and we have the bronze. So I know all of you have competed quite fairly. So those who will win the gold and those who will win the silver and those who will win the bronze are winners. But in true sense, all of us are winners. Yeah. It is only that that's part of life. In everything, there is always the ranking. But those who don't join the ranks, it doesn't mean that they have lost. Because if they were not there, then these winners would not be there. Yeah. So all of us, we are winners. Yes. But there are those who are in the gold category and silver and bronze. So we will rejoice together with them, as well as with all of us. So in the gold category, we had this innovation known as hydroponics AI. I think this is the one. This is the one to do with agriculture. I watched it briefly. They explained it to me briefly outside there on Monday. So we have hydroponics AI. And in this innovation, the lead innovator is Mr. Brevin Kulei. Mr. Kulei, you are there. Ah, wonderful, wonderful. Dr. What do we do with them? Do they come up here? Or they stay in the terraces? They come up here. They come up here. So, Brevin Kulei, please come. And then, so we have the certificate for Mr. Brevin Kulei. Where is it? Because I want to go through all this category before that. We are whispering here, but you are hearing everything. So, Brevin Kulei, you have a certificate. I'm holding two things. Congratulations, Brevin. Well done. This is your certificate. And then another gold winner in terms of innovation is Crime Accountability and Reporting System. And the lead innovator here is Irene Okwaro. Okay. Congratulations, Irene Okwaro. Another one under the gold category is an innovation known as Grand TIQ. Is that the correct spelling or pronunciation? Grand TIQ. Eh? Grant IQ. Yes, and the lead innovator here is David Saruni. Okay. Congratulations, Saruni. And then another one under the gold category is an innovation known as Respiramate. Is that correct? Respiramate. Respiramate. I see, oh, that is not the lead innovator. The lead innovator here is Margaret Njonjo. Yes, welcome, Margaret. Welcome. All right. Ladies and gentlemen, there are also awards that go with those innovations in the gold category. They have been awarded, number 1, 1 year web hosting services. 1 year web hosting services. Number 2, they have also been awarded Zoho credits. Number 3, they have been awarded Answer Village Academy training worth 50,000 Kenya shillings. Number 4, they have been awarded cash prize of 5,000 Kenya shillings. Number 5, they have been awarded the Kenya Innovation Week attendance. And number 6, they have been awarded intellectual property registration at KIPI. Thank you very much, ladies and gentlemen, and congratulations. Now we go to the silver category. Here we have the one innovation known as Agrigo. And the lead innovator here is Ivy Muthoni. Congratulations, Ivy. Another one under the silver category is Eco Defender. The lead innovator is Bismarck Kipkorir. Okay, Bismarck, come for your certificate. This one is not for Bismarck. Yeah? We will change. This is for the optics. Okay. All right. Receive your certificate, Bismarck, and congratulations. And then there is also an innovation under silver category. It is known as e-Republic. And the lead innovator here is Manthi Kevin. All right, okay. Congratulations, Manthi. Well done. And then another one is known as Air Class, under silver category, Air Class. The lead innovator is Millicent Morara. Congratulations, Millicent. Well done. Look at the camera. And then another one under silver category is Elevate Minds. The lead innovator is Franklin Owuor. Congratulations, Franklin. And then another one under the silver category is eggshell fortified porridge. I like that one. Eggshell fortified porridge. The lead innovator is Mary Muridhi. And Madam Muridhi is a member of our academic staff in the School of Pharmacy. There's a name we normally call each other. Can I mention it to them? It is pharmacognosy. Congratulations, Madam Mary. Yes. And then there is another one under silver category. It is called Green Tech. Green Tech, the lead innovator is Nathan Kimutai. Congratulations, Nathan. For the awards to the silver category, they will receive number 1, Soho credits. Number 2, 1 year web hosting services. Number 3, they will receive cash prize of 3,000 Kenya shillings. And number 4, they will receive IP registration from KIPI. And number 5, they have been awarded the Kenya Innovation Week attendance. And then we have the bronze category. The bronze category. You said we mentioned the names? Okay. So the lead innovators in the bronze category are Omukaga Dalmas, Lawrence Ndachi, Alan Mwanthi, Shadrach Mark, Stephen Mwangi, Gideon Ngetich, Jotham Mwangi, Peter Chepkwony, and James Shituku. Those are the lead innovators in the bronze category. Shall we please clap for them? Thank you very much, ladies and gentlemen. Then we come to, you want me to mention the innovations? Okay. And then, ladies and gentlemen, you are aware, oh, yes, the awards for the bronze category. The bronze category awards are, number 1, IP registration from KIPI. Number 2, they will receive the famous Kabarak University notebooks. And branded pens, which you will keep as souvenirs somewhere. I also have those. I've kept them as souvenirs. All right? So there is another category here, ladies and gentlemen. This event, we run it together simultaneously with the School of Pharmacy Research Conference. And under the School of Pharmacy Research Conference, there was the Health Tech School of Pharmacy Innovation Competition cash prizes. And these cash prizes have come to us as awards, courtesy of International Cancer Institute. This is the institute that we collaborate with here in the university to offer our Master of Pharmacy in Oncology Pharmacy program. Shall we clap for ICI? So there are also 3 teams here. Okay. These ones have envelopes. Thank you. So the first team here is the first place team. That's what they are called. And they have won 10,000 Kenya shillings. Can we clap for them? 10,000 Kenya shillings. This is it. And the lead person here is Agnes Okore. And the name of the health tech competition here is Clear RX. Congratulations, Agnes. Receive your envelope. Congratulations. And then in the second team, they have won 6,000 Kenya shillings prize. And this second place prize is under the innovation known as Clean Pro. And the lead person is Rachel Sandra. There's a nice envelope here for you, Rachel. Congratulations. Congratulations. The third place team won 4,000 Kenya shillings and an innovation known as Elimu Afya. And the lead innovator is Hope Yego. Congratulations, Hope. So, ladies and gentlemen, those are the awards that we were able to come up with during this competition. Is there another one? Yeah. Okay. Oh, all right. Okay. So before we end this session, we can't thank our guests enough. What we have here is just a small token of appreciation from the university. So under this, I have Dr. Joyfrida Chepchumba, Program Officer, National Cancer Control Program. Daktari, karibu. Congratulations, Daktari. Thank you for supporting us. And then we have Dr. William Ogal, PhD, Senior Research Scientist at Google Africa. Welcome, Daktari. Congratulations, Daktari. Thank you for supporting us. Then we have Dr. Winnie Mwangi, KUTRRH. This is Kenyatta University Teaching and Research Hospital. Vice Chair, Oncology, Pharmacist Society of Kenya. Welcome, Dr. Thank you. Thank you, Dr. And finally, we have Wilfred, Mr. Wilfred Chege, the CEO, Zendawa. Congratulations, Brother Chege. Thank you for supporting us. Dr. Nyawere, is there anything else to do? There's nothing. Okay. Distinguished ladies and gentlemen, by the powers conferred upon me by the Vice-Chancellor of Kabarak University, I declare the 2025 Central Rift Innovation Week officially closed. We want to go out of this auditorium with God's blessings, and among us is the university chaplain. The university chaplain is the Reverend Levan Kitony. Reverend, before you pray, just to say a word to this audience, and then you pray. Then after we have prayed, Dr. Nyawere, there is lunch for all of us somewhere. We will announce. Okay. So welcome, the Reverend.
Let us appreciate Professor John Ochola with Nyayo claps. No. With Nyayo claps. 3 Nyayo claps. Moja, mbili, tatu, ine, tano, funga, fungua. Very good. Thank you very much, Prof, for leading us in that session. I want to really thank God for allowing us to have that Central Rift Innovation Week. And I believe it has impacted many of us in one way or another. Just before I pray, I want to share a verse in the book of Genesis, chapter 1, verse 28. Genesis chapter 1, verse 28, where God blessed humanity with 3 things. Number 1, be fruitful. Number 2, multiply. And then number 3, have dominion over the world. Now, when we talk about dominating the world, it has to do with bettering the world, making sure that we use innovation to benefit us in one way or another. Our world can be better if we have minds that can think beyond what we see and bring about innovation that can help us make our life better here in the world. So that is my charge to you. As we end this conference, let us use that first initial blessings that the Lord gave us to better our world. Let us stand. So after the prayer, we will say the grace together. Our God and our Father, we congregate here this afternoon to give all the glory and honor to you because you've given us success this week as we gathered to think through issues that can help us and how we can better our lives in various forums. Thank you, Lord, for the Innovation Week. Thank you for the many things that we have achieved. And it is our prayer that you may help us continue to better our world, even through the innovation that we have. Father, we want to thank you that in many ways you have called us unto rulership of this world, that we may better it for your own glory and honor and for the enjoyment of all people. As we go, it is there that you may help us impact one another and impact our world. And that, Lord, it is our prayer that you may continue to take care of us and bless us. And even for those who are traveling far and wide, we want to pray that you may give them safety over the highways until they reach their destinations safely. Disperse us now with your blessings. For we pray with thanksgiving in Jesus' name. Amen. And now may the grace of our Lord Jesus Christ and the love of God the Father and the fellowship of the Holy Spirit be with us now and forevermore. Amen. Thank you very much, and may God bless you. So thank you very much. There is lunch. Let's thank God for lunch. Father, we thank you for the provision of lunch. As we partake of it, may you bless our fellowship. We pray with thanksgiving in Jesus' name. Amen. Thank you very much. Enjoy your afternoon.
Just an announcement to our guests and committee and management. We are going to the boardroom of School of Law. And that is our guest, our management. We are and the innovation committee. Kindly, we go to the boardroom. The meal cards are being provided right out here. Your meals are taken at normal place. Kindly, and may God bless you about that. Thank you.